Alrighty, hello everyone. I want to say a quick thank you for those popping in and joining us for our webinar today. My name is Dylon Hoffpauir, and I am an admissions counselor here at the Tulane University School of Public Health and Tropical Medicine. And today you are viewing our second installment of our Pathways to Public Health webinar series, where each week I will be interviewing a faculty member, talking about their experience, talking about the research that they're doing, and giving you kind of a bird's eye view of what you could potentially be learning or doing as a student at Tulane. So today I am excited to be chatting with Dr. John Lefante. He's going to share some of his experience and his research with us today. So I'll turn it over to you to go ahead and get started.
Okay, thank you, Dylon. And I'm going to share my screen here. So, okay, and let me welcome everybody too, and thank you for tuning in. This particular presentation is going to talk a little bit about my background and how I got into public health and the type of work I've done over the years. Some old work, some more recent work, but I'm in the Department of Biostatistics and Data Science, and I'm a biostatistician. So I'll try to give you the perspective of what a biostatistician does in areas of public health. So the topics that we're going to go through, I'm going to start with a little bit of my background, how I got where I am, my educational background, my academic journey. And then my specialty is, as I said, biostatistics. So I'll talk a little bit about how I use my expertise in different research projects along the way. And I do a lot of very applied work. I do a lot of collaborative work, which is actually one of the things I like the best about public health, is that there's opportunities to collaborate on many different projects and apply your expertise in different studies. And then we'll just mention a little bit about where the area of biostatistics is going in terms of data analytics, and actually the explosion in recent years of the area called data science, and where biostat plays a role in the area of data science. And then a little bit about what you can do with a degree in biostatistics. And we have here at the school two different master's programs, an MSPH, which is a very applied degree in biostat, and an MS, which is a more theoretical degree. And we also offer a PhD. So we'll talk a little bit about what you can do with those individual degrees, and then a little bit about what life is like here for a person like me in the School of Public Health. Okay, and what's particularly enjoyable about being faculty here. So a little bit again of my background. I started out in education. I planned to be a high school teacher when I was an undergrad, and I got a degree in math education, and did not teach in high school. Went right into a master's program in mathematics at the same university, University of New Orleans. Got a master's degree in mathematics. And from that degree, my advisor happened to be moving into biostatistics. He was leaving UNO and going to UAB, University of Alabama, suggested I consider a PhD. This was my first introduction to biostatistics and actually to any applications related to public health. So prior to this, I had no idea what public health was or any interest really in going into public health. But I went and got a PhD in biostatistics. Part of what I did when I was still in Birmingham was I started working as a statistician in the Southeastern Cancer Study Group, which at the time was a large cooperative group that looked at cancer research, looked at survival analysis, and compared different treatment groups. And my job, being an introductory person, was pretty much data management, some analysis, some report writing, and it was a good introduction to how biostat is actually applied in different areas. From there, I went and actually to my first faculty position at the University of South Alabama in Mobile. did a lot of teaching, and some collaborative work with a small medical center they have there in Mobile. But when the opportunity came to move back to New Orleans, and we'll talk a little bit about New Orleans later and why, I so much enjoy living here. I actually grew up here. So I took the opportunity to move back to New Orleans, and at the time there was a position in Department of Medicine and Pulmonary Disease section, analyzing data on occupational lung studies. The person who hired me and became my mentor, Dr. Janet Hughes, was full professor in the Department of Biostatistics here in the School of Public Health. And this was the first time I actually interacted with folks in different disciplines in public health, because in this particular pulmonary diseases section, it was truly a collaborative endeavor. We had pulmonologists who would measure pulmonary function on workers. We had individuals, also school of public health faculty, that were in environmental health, that did exposure assessment. And then we had a biostat group that I was part of that were made up of faculty in public health that actually did the data analysis, putting all this different data together. And so it was first introduction to actually how public health experts interact with each other with different disciplines. Truly collaborative work. From there, I had the opportunity to actually move into public health into the department, and I've been in this department for quite a few years. And at the present time, the department is called Biostatistics and Data Science. At one time, it was Biostatistics, and it was Biostatistics and Epidemiology. But these things tend to change over time, and so I've been here all this time. So as I said, my specialty is biostatistics, and a biostatistician is a person who not only analyzes data, but also is involved with the designing of the study, determining best study design, helping determine how many subjects should be in such a study. And of course, after analyzing data, how do you present results clearly? And so a lot of it deals with communication skills. A lot of statisticians and biostatisticians spend their entire career doing statistical methodological research. So if you have a real interest in mathematics and that side of statistics, there's a whole area of biostat where people would do that. If you're interested in very applied work, though, where you like working with computers and analyzing data, then you can also go into biostatistics. The kind of work that I did in the pulmonary section was occupational lung studies, where we analyzed data on cotton processing exposure, chemical exposure, wood dust workers, Katrina cleanup exposure. And so all of those studies were very applied work. After working for many years in pulmonary, I also had a project where we did back up. The pulmonary research was all research. This was all research, but there's also opportunities to do real public health practice. Okay, and back in 2001 and going into today still, there's a foundation in central part of Louisiana, the Rapides Foundation, which put their money into, among other things, funding a program that they called CMAP, which stood for Sentinel Medication Access Program. Sentinel stands for Central Louisiana. They put their money into a program that could provide low-cost prescriptions to people who couldn't afford it. And we had a contract with them for many years to evaluate their program. So we did program evaluation. We collected data, and we tracked individuals, and we were looking to see whether or not patients would stay on their medication. We looked to see whether or not the number of emergency room visits would go down over time. And it's a real example of how not only are we doing public health practice, but we're doing the kind of work that actually does benefit individuals and the community. Another project that I've been working with for quite a while is another cooperative group, is a project called the Louisiana Clinical and Translational Science Center. This is a large cooperative group between Tulane, LSU Health Sciences, and Pennington Research, which is in Baton Rouge, Louisiana, to increase the capabilities for clinical and translational research. Translational research is research where where if you can take the research that is being done either in the clinic or in a laboratory setting and actually translate it to the public so that you see actual real benefit of the research that's being done. And I just put this graphic in. This is the graphic that Lefante uses to show again the collaborative nature of this kind of work. Down here, if you can see under study design analytics, that's the group that I belong to. But there are individuals on community engagement, and there are individuals on health literacy and ethics. And the folks that run these particular sections tend to be folks in public health, the community engagement folks, the study design folks, biostatisticians. Health literacy tend to be community health educators. And again, a good example of collaboration among different individuals across different disciplines in public health, and very applied work in terms of what a biostatistician would do. Another project that I've just joined recently is Starmap, which is it's not headed by us, but it's headed by researchers in medicine and public health, where the long-term goal is to improve medication adherence. So I've done a lot of applied work in health system and health policy in terms of medication adherence and improving things like blood pressure control. And another study that's similar, it's not looking at blood pressure, looking at opioid treatment. This is a study where I analyze data and design studies on work that's being originated actually at a health system in New Orleans and across the state. Part of this is that we had to come up with a pretty unique design of how to collect patients into the study. So part of what you would do as a statistician, as I said earlier, is you'd be involved at the early stages of designing these studies. So when we talk about where biostatistics is going in terms of biostat and data, it used to be biostatisticians would, and they still do, they'd be involved with, having a data set and you would do some analysis, and obviously you would use computer programs to do this. With the explosion of large data sets that are around and everywhere, in terms of social media, in terms of the capability of collecting a lot of data, that there's more and more need for technology to handle this type of data. And that all falls under the umbrella of data science. Data science includes statistics, it includes computer science, in a lot of areas it includes genetics research. And so, statisticians these days need to know about data collection, need to know about how to manage databases, something about computational work. You don't have to be a computer programmer necessarily. You can be a computer programmer, but you don't have to be, as long as you have an interest in using software and learning some code. And of course, data analytics, which is the analysis part, and a big portion of what we do these days in the future is what's called data visualization, ways of looking at different graphic representations of data. And a lot of this deals with computer simulations. So if you're interested in studying biostatistics, as I said earlier, I think that there is an area of biostat where if you're interested in mathematics and you want to learn to do the theory side of this, then you would study, get maybe a master's in science degree. And if you're interested in eventually going for a PhD, you might be interested in going in that direction, because a PhD is going to require a certain amount of math background. But if you're just interested in being an applied data analyst, then you would go maybe into school like ours for a Master of Public Health, which doesn't require as much of a math background to get into. The types of positions that you would be interested in that would be available to you would be maybe a data manager on either a research study or a public health intervention program. And of course, a data analyst, somebody who could actually analyze data. Some of our graduates have actually got positions at different institutions as instructors, teaching stat classes. And some, mostly at the PhD level, have become university faculty. Okay, where if you're a faculty member like I am, then you're probably trying to do all of those things, which is what I like about this, the variety. You can teach class, you can do research, you can interact with, in an applied way, or you can do theoretical research if you're interested in getting a PhD in the area. The different locations, different places people have gotten jobs when they graduated here have been, like I said, universities, some private foundations, if they're doing either public health intervention work or they're doing tracking, public health tracking, or research. Foundations will hire people with degrees in biostatistics. Some private industry jobs, and some have gone to government jobs like the CDC or NIH. And so I'm going to say the best part of being faculty here at the School of Public Health is probably the different types of students we have and the opportunities we have to interact with students. Most of our students, besides just taking classes, also are interested in getting involved in research in either in our department or in other departments. We found that every department in the School of Public Health is looking for individuals who have quantitative skills. So our students, if they don't get a job in our department, they usually don't have a problem finding a job or student work while they're here in other departments, because either here or in the School of Medicine, because people are looking for individuals that have quantitative skills. Another thing that I like personally about being on the faculty here is that I get to interact not only with different students, but in different programs. So here at the school and university, we have also an undergraduate degree in public health, a Bachelor of Science in Public Health, and I teach in that program also. So I'll teach undergrads in that program. We also, as I said, we have the Master of Science in Public Health, which is the more applied degree, and we have an MS degree, which can be more theoretical. So I teach courses in both of those, and we have a PhD program. The online, we also have an online degree, and we're moving more and more in that direction. We're investigating, looking into what it would take to offer a certificate online in biostatistics. But we do have a degree in the school, online degree, and I've taught in that program also. And I guess that I mentioned this earlier, but what I really enjoy personally is the collaborative work and the opportunity to work on many different types of projects across the school and the university. So that's about my presentation. So I will stop sharing my screen and turn it back to Dylan.
Awesome. Well, thank you for that. A lot of interesting and unique research happening. And my first question is, and I think you kind of hinted at this already, and you talked about a lot of opportunity being at Tulane, and you said the student body is very diverse, so is the faculty in what they study. So I guess stemming from that, let's say we have someone watching who's interested and they know they want to pursue biostatistics or some type of data management. What is I guess, a big piece of advice that you would give them when choosing maybe a specific school or a specific type of degree? What advice do you have for somebody who knows they want to study in this area?
Well, it's always good to have some math background, right? I mean, you'd be in we don't necessarily, you don't necessarily have to have had a full 3 or 4 classes in calculus. It doesn't hurt. But if
Right.
you're interested, I think more importantly, if you're interested in being more of an applied person, then I think just some background using computers, which most folks these days do. So I think any computer literacy is going to help you. You know, if you're interested in more theoretical, then you should do some math background, but most people think that, oh, I didn't have a lot of math background in my previous studies, so I really shouldn't go into this area. And you'll be surprised that it's easy to get into the area if you're interested in organizing things, because a lot of it is organizational. And so you don't have to have a lot of background in mathematics to actually get an applied degree in biostatistics.
And on the other side of that, sometimes I interact with students who don't really discover public health until later in life. We do have a lot of non-traditional students who are not coming straight from undergrad here in the School of Public Health at Tulane. So what about advice for someone who is interested in public health and maybe they don't know what area they want to go into, but they know that they want to study public health. They just don't know a specific way to choose an area of study. Do you have any advice for them?
Yeah, well, the best thing is to try to communicate, right? Try to get in touch with us, and we're all, just about everybody in the school and every department is interested in available to talk about these things. So, if you have a real interest, reach out, and Dylan, you can talk about how they can make a connection. I'm very happy at any time to talk to anybody about what we do in biostatistics. And I'm happy to give you my impression of what other folks do in other departments, and I think, what comes to mind with this is I've got a personal example. One of my daughters got her undergraduate degree in art. She was an art major.
Yeah.
And she liked science, and she did some other things, but she got a degree in art. She graduated, and she taught art in high school for 2 years, and decided she wanted to do something different. She went back to school, and she got an MPH in epidemiology.
Wow.
So, it's never, public health is the kind of thing that you can get into with all types of backgrounds. So,
Right.
because a lot of what you do in public health in the beginning is you take an introductory course in public health, and it all builds on itself. So it's not like, I don't think it's ever too late to get involved. Now, if you're interested in going into a more theoretical area, like you expect to have some base for that, but I think it depends on what area you want to go into. So I think applied biostatistics, probably applied epidemiology, community health. I think you can get into public health with your basic undergraduate knowledge. That's my
Awesome.
person. Yeah.
Yeah, I would say in my time at Tulane, I've definitely observed students from all backgrounds, from directly from an undergrad public health program all the way to something that you would never pair with public health. But
another example I've got, one of our recent graduates who's very good at graduate, got an MPH in biostatistics, came to the school with an undergraduate degree in creative writing.
Wow.
And that's actually a very good skill to have in public health, because so much of it is effective communication.
It's good. You need to know how to communicate well.
Right. And she has a degree now in biostatistics, and she works in the Department of Epidemiology here. She got a job in Epi, and she does research studies, and she has the great combination of the quantitative background, and she can write. So
that is amazing. There really is a place for everyone. And like you mentioned earlier, it's super easy to get in touch with someone in the school. Yes. Part of what I do is connecting students to faculty members like you and faculty members in other departments that they might be interested in, and getting them in touch. So if anybody's watching and is interested in talking to Dr. Lefante one-on-one or any other member of our faculty at the school, you can always just reach out to us. And that information is on our website and our social media. I do want to ask you, you mentioned earlier that you grew up in New Orleans. So can you talk a little bit about, New Orleans is kind of smaller areas that make up the city. So if you want to talk about where you grew up and where you live now.
Sure. So I grew up in the area, on Carrollton area, which is, it's right, we call it Carrollton, uptown Carrollton, and it's right at the river bend. Here's a river behind me. It's right where the river turns Carrollton Avenue to St. Charles. So not far from the uptown Tulane campus. That's where I grew up and lived here all my life. I actually was born in New Jersey. My father was from New Jersey. My mother's from New Orleans. So when I was about 3, we moved back here. And so it's all I remember is New Orleans. And then the only time I have not been in New Orleans, I went to graduate school in Birmingham and 5 years there and 6 years in Mobile. So, and we moved back. So, New Orleans is home. It's where we like being. My wife's from here. New Orleans has and it's cliche and everybody hears it, but it has its own feel and its own flavor, and nowhere else is like it. And now I live actually on the west bank of the river. I live on the other side of the river in Algiers. And it's a short commute across the bridge to get downtown. So that's been fine too. But New Orleans is great. It's got the neighborhoods. It's got all how do I explain the neighborhoods? I mean, it's got different neighborhoods, but a lot of those neighborhoods kind of meld into each other, and every different neighborhoods have different feel and different flavor, but New Orleans is the kind of place that you walk down the street and people walk by you, you tend to nod you and say, how you doing? It's not like some places where you don't look at each other and you don't know the person, but people just are pretty friendly here.
Definitely.
Yeah.
Absolutely. Well, thank you so much for taking the time to talk to our viewers and our friends watching on social media. I think it's important for people outside of the school to hear what our faculty members are doing, and people who are interested in pursuing an education here to hear what our faculty members are doing. So I know I appreciate your time greatly, and I know everyone watching does as well. For everyone watching, this video will stay on our Facebook page, and you can also find it on our school YouTube page. Just search Tulane University School of Public Health and Tropical Medicine, and stay in touch with our social media page as well on Facebook to see the rest of our webinar series, which will be posted right here on Facebook. And again, thank you so much, Dr. Lefante. Thank you to everyone who's watching, and I will see you guys for our next webinar.
Okay, bye.